The coronavirus pandemic has now claimed 5 million lives. Nearly 2 years after the first outbreak in the Chinese city of Wuhan, COVID-19 remains a leading cause of death around the world. The United States has the highest official toll, with more than 700,000 recorded deaths and less than 60% of the population fully vaccinated. Brazil has also been hit heavily, losing more than 600,000 lives. And India's second wave ruined the country's hopes of avoiding the worst. The official death toll there stands at just over 450,000, but many researchers estimate the real number is at least 1 million.
A family broken apart by COVID-19. James Mwangi watches as his uncle is lowered into the ground just days after he buried his father and grandmother.
We are traumatized because it's not so easy. Some people, you are with them 2 weeks ago, they had no issue. Then all of a sudden, in a span of less than 10 days, they're all gone.
This funeral is in Kenya, but grief has touched every corner of the globe. In under 2 years, the virus has cut short the lives of 5 million people. From mass grave sites in Brazil to overfilled hospitals in the UK, the world has learned a new meaning of loss since the pandemic began in early 2020. The world's wealthiest were not spared. The US has the highest official death toll of any country. Tate Azai and his pregnant wife turned down the vaccine, and then she fell ill.
As things got worse and worse, I started really worrying about the baby. And then at some point, the baby just didn't make it. She was too low on oxygen.
No country has suffered a wave of COVID-19 as swift and deadly as India's. By the time its second wave subsided, the official death toll had reached 400,000. But most rigorous studies estimate it was at least twice as much. 42-year-old schoolteacher Kavinder Singh was one of the victims. Beloved by his community, his funeral brought together friends and family. He was one of many bid farewell at this booked-out crematorium. What can we do? Yes, we're angry, but what can we do? We don't know how many people are suffering like him. Even in my own village and nearby villages, there are people like him in their 40s who are teachers who have died. In my village, 6 or 7 people have active infections. While the virus continues to spread around the globe, vaccines, as well as new treatments, have begun to help slow the death rate. It's now a matter of getting these life-saving innovations to as many people as possible.
Well, Germany is also seeing a sharp increase in new coronavirus cases. Numbers are up from just under 500 new infections a day in mid-July to more than 27,000 new cases in one day at the end of last week. Concerns over a possible fourth wave have health officials pushing for a rapid rollout of booster shots before winter. But what's also worrying is the number of fully vaccinated people who are amongst the new cases. DW's Tessa Walter spoke with a doctor who became a patient.
Even simple things are still difficult for Lioba Hulsbömer. 2 weeks after her COVID-19 infection, the 30-year-old still struggles to get back to her old life.
Normally I go running every other day and do a lot of other sports and exercise, but I've put all that on hold for now, simply because I notice my breathing is still a bit tight. When I climb stairs, I notice I have to do it slowly, I have to catch my breath a lot, and I have to take breaks.
Lioba still tries to get more rest than usual. Finding her way back into her job as a surgeon is difficult. She contracted COVID-19 despite being fully vaccinated. For over 2 weeks, she was sick at home.
I did not expect to have such a severe illness. I thought someone like me, at 30, with no pre-existing conditions, would just lie in bed for 2 or 3 days and relax the rest of the time in quarantine. But it was definitely not like that for me. I was very, very sick for 2 weeks.
More and more breakthrough infections are being reported in Germany. Among around 55 million fully vaccinated people, around 118,000 had a breakthrough infection. This number is also visible in intensive care units. According to current figures, around 10% of people in ICUs between 18 and 59 are fully vaccinated. It is even 30% for over 60-year-olds.
However, that doesn't mean that vaccination doesn't work. If you look at the number of breakthrough infections, you see that they still represent the minority, although the number of vaccinated people is much higher. From this ratio alone, you see that a vaccination still protects really well.
Leobar's vaccination was over 7 months ago, which could be the reason for her infection. Despite her experience, she would get vaccinated again.
I have in no way lost faith in vaccination. I'll definitely continue to be vaccinated against all infectious diseases. I believe the course of my disease would have been much more serious without being vaccinated. And it protects you from dying of infectious diseases or from suffering a severe bout.
Leobar now takes everything step by step, and she's hopeful that she'll fully recover soon.
Well, Dr. Tina Rudolph is not only a medical doctor, but also a member of the German Parliament for the Social Democrats. Welcome to DW, Doctor. How much of a risk are these breakthrough COVID infections?
Yes, as was already mentioned, we are very worried about the breakthroughs at the moment. But it was also mentioned that we can see that the vaccination still is a protection, that usually the symptoms are less severe after a vaccination, especially after complete vaccination, and that in the ICU units, the patients who had the full vaccinations still are not the overwhelming number. So this is what we have to point out at the medical side and politically, that we still need to increase the number of patients, of people who are fully vaccinated. Right now in Germany, these are 2/3 of the population, so 67%, but this is not enough to really get the protection. And as it was also mentioned, we are currently thinking about giving the recommendation for people who are vaccinated after several months to get a booster vaccination.
Yeah.
So as it was mentioned in the example, so the doctor we heard had the vaccination 7 months ago, and so currently we are discussing whether there should be a general recommendation for people after 6 months to get the booster vaccination.
And yet, just on the boosters, we have 15 million Germans over 70 who are eligible for booster shots, and many German states are only just starting to administer them. Are authorities moving too slowly again?
What we can see is that we are struggling into the 4th wave, and we have to do as fast as possible what we can do. And the recommendation is already out. So what we need now is that people get aware of the situation and that people go and see their doctors when they have the recommendation for the booster vaccination.
The German Parliament will decide in 3 weeks whether to end the state of emergency. What would you like to see happen?
The declaration of the general state of emergency, which was planned to hold place in the end of November, just would mean the end to the general state of the pandemic situation. This means not, however, that the pandemic situation is over in Germany. This would be the wrong impression. What we can see, however, is that the incidence differs in Germany. So we
Can I just interrupt you there? With 30 seconds to go, what would you like to see Parliament decide?
I would like to see Parliament decide that also when we declare the general pandemic state to be over, that there still is room for the German federal states to have some room for decisions for requirements that are still to be made. Especially the testing has to go on, especially when we see that it doesn't prevent you from getting the virus and from spreading the virus, that you got the vaccination. So this is what we have to do besides from declaring the general pandemic situation to be over.
OK, thank you for that. Dr. Tina Rudolph, SPD member of the Bundestag. Thank you.
Thank you so much.
Let's take a roundup of some more headlines from the pandemic. Israel has opened its borders to fully vaccinated visitors for the first time in 20 months in an attempt to boost the country's struggling tourism industry. In the US, White House Press Secretary Jen Psaki says she's contracted COVID and she's not part of President Biden's delegation to the COP26 summit this week. And the European Commission has suspended its funding of the World Health Organization's COVID-19 programme in the Democratic Republic of Congo. This over the UN agency's handling of a sex abuse scandal.